My name is Dr Tom Crabtree and I'm a consultant in diabetes and a research fellow working with the Association of British Clinical Diabetologists. Thank you for taking the time to view this poster presentation where we examine the impact of age on response to injectable semaglutide and share some insights from the ABCD audit programme. These are my disclosures. The ABCD audit programme for injectable semaglutide or Ozempic was launched in 2019. The aim of this was to collect real-world data on semaglutide use and to compare this with randomised controlled trial data. The key reason for doing this is that we know that individuals included in randomised controlled trials may be more restricted than the individuals that we're seeing in clinical practice, and so the hope is that this data can improve the generalisability of those robust randomised controlled trial findings to UK clinical practice. So what do we know so far about injectable semaglutide or Ozempic? Semaglutide has demonstrated across the SUSTAIN trials reductions in HbA1c and weight. Whilst weight loss may be desirable in a younger population, there might be concerns about weight loss in older individuals where this could, in fact, lead to an increase in frailty. We also know from pooled analysis of the SUSTAIN trials comparing younger and older individuals that there were less significant HbA1c reductions in individuals who were older. The aim of this analysis was therefore to assess HbA1c and weight outcomes across 3 different age groups: those aged less than 40 years, those aged 40 to 64.9 years, and those aged greater than or equal to 65 years. We included all individuals with available baseline and follow-up data for HbA1c and weight, and we used a multivariate regression analysis to correct for other covariates and did Bonferroni corrections to correct for multiple analyses between the 3 groups. The baseline characteristics of the groups are on screen at the moment. In total, we included 1,623 individuals with type 2 diabetes. 49.9% of the population were female, and we followed them for a median duration of 0.7 years. The baseline characteristics, other than age, were broadly similar between the groups. However, we did note significant differences between weight between the youngest, so those aged less than 40, and the oldest, so those aged older than 65, at baseline, with the youngest group being significantly heavier, with a baseline weight of 115.5 kilograms, and the older group being significantly lighter at baseline, with a baseline weight of 101.8 kilograms. The HbA1c reductions for each group are displayed on screen at the moment. As you can see, there was a numerically larger HbA1c reduction in the youngest group at 1.4%, however no statistically significant differences were noted. This may reflect the relatively small number of individuals included in this analysis, and therefore more data will be needed to see if this is comparable to that pooled analysis we mentioned previously from the SUSTAIN trial, and perhaps there is a genuine more beneficial effect in terms of HbA1c reductions in younger individuals. The results for weight change are on screen now, and you can see broadly similar weight reductions across the 3 groups, although this time numerically higher in individuals greater than or equal to 65, and comparing each of these groups, there was no statistically significant differences. To conclude, we observed similar weight loss and HbA1c reductions irrespective of age, and although weight loss may be desirable in younger individuals with type 2 diabetes, it may be less desirable in some individuals in older age groups where this could increase the risk of frailty. Therefore, one of the things we need to do moving forwards is to understand the impact of semaglutide and other GLP-1 receptor agonists in individuals with frailty and on frailty markers. I'd like to thank you for taking the time for viewing this presentation. If you have any questions, please feel free to reach out, and I'd like to thank all centres contributing to this work. Thank you again for taking the time to view this poster presentation.